So welcome to the first edition of Coffee Talk with Drew Walk. We've got Drew Walk and Jody Thompson introducing SoleoRare. Hi, I'm Craig Vollmer, Chief Commercial Officer and co-founder of Soleo Health.
Hi, I'm Drew Walk, and I am CEO and co-founder along with Craig.
Hi, Jody Thompson, Senior Vice President, Rare Disease.
So Drew, take us back to the beginning. When you started the company, obviously several years ago, what was the unmet need you were trying to solve?
So Craig, this is back 11, 12 years ago when we first started talking about building something we thought would fill that gap between what the large integrated providers were providing and the small, local, nimble providers just couldn't provide that level of service at scale. And so we thought we could build something that could be a national company that could provide the level of service that a small local provider could provide, but do it across the country in every single market.
So rare disease represents a significant part of the pharma pipeline. Why is it important to launch SoleoRare now?
Well, really, it goes back to our founding, Craig. When we started this company, our focus was on complex therapies that would fill an unmet need that wasn't really being provided by some of the large national providers, and the local providers couldn't quite get there in terms of the complexity of the care. And so those complex therapies, the majority of them really are rare diseases. And so it is in our DNA. It's what we've done from the very beginning. And it's really why we founded the company, is those complex diseases that are primarily rare and don't occur very often, but they have a very difficult patient journey associated with them. And so our idea is from the beginning of the founding was we'd help patients in that journey. And as we've progressed over time, and we recognize that we haven't really articulated how much we really do for the rare disease patient. And the marketplace has really focused on the rare disease patient because of the pipeline of development of new therapies for them. And we felt it was really important to demonstrate to the marketplace that we know rare. We've been doing it since the beginning of our founding, and that it's a really important part of our patient care model.
Yeah, I really think, when we think about the rare disease space, it is long and complicated. Those patients, it takes a long time to actually be diagnosed potentially, and then those new therapeutics are coming out. It's scary having those new diagnoses. You don't know what to expect. A lot of these rare disease patients are pediatric, so the parents are involved, and being a part of that journey is incredibly important. I agree. We touch so many of these patients, but also the caregivers and the parents. And the real value that we're bringing as a company. But I agree, we know rare.
Yeah. I think the investment we made from the very beginning was really built around chronic patients that are not easy to manage and that need a robust clinical team to support. And that just fits right into the rare model. And so, you think about when we started and how we've done it, and the growth and development of new therapies just fits right into the profile of what we provide. So
what makes rare disease different from traditional specialty pharmacy support?
So the real difference is every patient has to be treated as an individual. So no one patient is the same. In regular specialty pharmacy, when you have tens of thousands, hundreds of thousands of patients receiving care, the pharmacy can build up a scalable model that services those patients pretty efficiently, and there's a lot of resources available for those types of patients. But on the rare side, there just aren't many experts in the space at all, whether it's on the physician side or whether it's on the pharmacy side. The clinical expertise is limited because there just aren't that many patients. And so the pharmacies in the rare space, they have to be specialized, and they have to really understand that disease, and they have to really understand how the patient journey can be impacted by the interaction with the clinical team at the pharmacy. And that takes a big investment in time and resources, and is really important to helping ensure the patient has the best outcomes.
Yeah, I think we often talk about those larger specialty pharmacies. It's such a huge amount of patients they're managing at any given time. And it really is something that we recognized early on, is it's not a prescription, it's a patient.
Yeah, absolutely. It's a patient, and we have to make sure that our clinicians have the time and the expertise in order to be able to service those patients in a different way, because they really do deserve and they really do need someone who's focused just on their therapy. Each journey is unique in itself, and how can our clinicians partner with the patients and their caregivers to make a difference?
I often think it's more of the distribution model, right? The centralized, large mail order pharmacy, just getting that prescription out the door, whereas our team is really focused on the individual, right? It's the clinical management, it's all of the needs that those individual patients and the caregivers and the family members are going through, right? It's a full support, and it's more than just distribution.
Yeah, there's no question. There's so much pressure on cost controls and on drug spend. And when you look at again, some of these therapies that are $20 billion in spend on one drug and one therapy, and that creates an environment where there's a lot of investment, and there's a lot of scaling that goes into that really, frankly, kind of has to be focused on the numbers. It has to be focused on the efficiencies. But when you talk about the rare disease, where you're talking about just a few hundred patients in the entire country, or several hundred patients in the entire country, it can't really be done that way because it's so difficult to scale that across an entire enterprise. So you have to really take a different approach to it, and that's what we really try to do.
Yeah, it's that therapeutic approach to those individual patients. So Jody, 40% of rare disease assets coming to market in their first year launch typically miss the mark. Why do you think that is?
Well, it's interesting when you think about it from a manufacturer's perspective of just the amount of resourcing and time that goes even to get to a product to market. And so even prior to a launch, companies are putting personnel, clinical trials, a lot of financial investment into getting these products available for patients. And that becomes a big moment for them that they finally get to launch. And if you think about the rare disease journey, and we talked about it a little bit before, these patients are difficult to find. The diagnosis could take up to years. Once they get diagnosed, these patients don't have a big community for them to reach out to. So if they're talking with their friends or their family members, there isn't a lot of people that understand what they've actually gone through or what that disease may even be. Sometimes even the name of the disease goes beyond what even people have ever even heard of. And you have specialists that aren't all consolidated into one area where those patients are. So getting them diagnosed, getting that referral pathway parsed out for them to know, once I get diagnosed, this is where I'm going to get my treatment, this is how I'm going to get coverage. And it becomes very difficult for that patient to find a succinct journey to go through. And then if you think about access barriers, so when a patient actually gets that prescription in hand or the referral comes out from the physician, we have payers that are putting in prior authorizations onto the market because of just the cost of the drugs. I mean, these are not low-priced medications, and so the prior authorizations, the denials, the appeals support that goes into it, that becomes very difficult for that patient, especially somebody that's not had to walk through that before. And our abandonment risk, so if you think about abandonment for patients, they have, now I'm in a position where I don't have a lot of people I can speak to about my disease. I feel very isolated. I feel that I'm not going to be able to get therapy because my payer is denying it, and there's a lot of clinical documentation that I have to go back and forth through. So there's just a lot of barriers when it comes to launching in the rare disease space that we're seeing coming into the market, and it gets more difficult and challenging to do that.
But it's a rare medication, and that means it's typically not on the formulary for the payer. So it does take some time for them to even understand what the medication is. And to your point, the cost is far, far greater than your traditional medicines that are coming out. And I think that's part of where the specialty pharmacy partner really can go out and educate the payers as well.
Absolutely. I think education really becomes key because the patient's getting educated. Many times the physicians, the HCPs, are getting educated on the disease state. Payers are getting educated on what's appropriate and not appropriate. And the SP is really in that place where they can pull all of those pieces together and really be a great advocate for the patient during that time.
I honestly think that's the way Jody articulates it is exactly why we want to position ourselves to be partners these are exactly how you can be partner with your pharmaceutical clients, so that you can, when you partner together, we're so much better if we work together to take care of these patients than we're working independently. And that's really what's appealing about SoleoRare, is we need each other. When we need each other between the manufacturer and the pharmacy that they work with. We work together in a synergistic way to really bring meaningful value to the patients that suffer from these rare diseases.
Yeah, I think you bring up a great point. When you talk about payer benefit design, right? The complexity, sometimes it could be in the medical benefit. It could also be in the pharmacy benefit. Not every specialty pharmacy has that level of expertise. I think that's one of the things that we see. One of the differentiators in SoleoRare is that complexity, handling those complex patients regardless of benefit design.
Absolutely, and I think even going further is just any type of route of administration. And you go back to the conversation of why you built Soleo Health, and we are able to service any patient, anywhere, with any payer, regardless of route of administration. And I think that becomes much more important as we're in the rare disease space, because we're going to see those complexities with those patients and payers.
So Jody, that is again where, when we think about the healthcare system and how fragmented it really is, because you really don't have all parts of the healthcare system working together to provide the best outcomes. And one of the opportunities you can do when it is a rare patient and you have a situation where the pharmaceutical manufacturer needs these services, we can really fill that need to work with the pharmaceutical manufacturer, but also to fill that need for the patient, so that we can actually truly work together to make a meaningful difference, as we said before. Because that fragmentation around how payers operate, how physician practices have to work, how other distribution centers have to work, when you can kind of eliminate all of those pieces and make it so that we're really working together, that again, that approach, that synergistic approach, really makes a difference and really helps patients through this journey.
So given these launch challenges, what should pharma manufacturers be looking for in a specialty pharmacy partner?
I think that's a great question, and it evolves, especially as we get into new therapeutic areas and new disease states. But I definitely feel, and this is a common thread that I'm hearing us talk about, is partnership. And I think the earlier the partnership focuses on the channel strategy and how the patient is going to get access to the product and how all pieces are going to support that patient, then the patient's going to win faster in the end. And when we think about the specific areas where there needs to be partnership, one is payer coverage. And so if you have a specialty pharmacy that has strong relationships with the payers, that have great contracts out in the market, that are able to reach out to the payer and have a discussion about prior authorization or appeal or why something is getting denied, that will actually expedite the patient's access to therapy. And I think another area where a specialty pharmacy could really help bolster what's going on with a launch is the clinical expertise that you can have within the specialty pharmacy. And a benefit for Soleo Health is that over 50% of our employees are clinicians. And so when you think about the limitations that a manufacturer has, they're not allowed to talk outside of the PI and have a deep clinical conversation, especially regarding discontinuations and adverse events. So if you partner with somebody like Soleo Health that has such a high clinical background, then they're going to be able to have those conversations with patients and really supplement what the manufacturer is not able to do. I also think as you have transitions of care, many of these rare disease patients are diagnosed in the hospital setting and they need to have a transition externally outside of that hospital. And I think a specialty pharmacy partner that can provide care for patients regardless of route of administration, whether that patient needs to have an oral or have a sub-Q medication that's HCP administered or self-administered, or if that patient needs to go home for home infusion or be seen in a clinic for an infusion, a specialty pharmacy partner that can provide that, all that integrated type care for a patient is going to be really beneficial for them.
I think one of the important parts too is the nursing component, right? Not every patient's going to require nursing, but the ability to have that is incredibly valuable. And I think that's one of the things, one of our hallmarks is the fact that we employ so many of our own nurses, right? We've got that ability to really not just deliver the medicine, we actually can cross the patient's threshold into their home with our nurse and really become a part of the fabric of that family. That's important. Even if we're not doing the administration, it's the education component, right? You often talk about it's a scary diagnosis. No one knows what to expect. That's really where the Soleo nursing and our pharmacy, those folks can really come into play and really get them comfortable with what to expect, because it is a long journey.
I think manufacturers are trying to find ways to control the launch as much as possible. So if you think about having employed nurses and what that brings to the patient is now that you also have a consistent experience that the patient gets to feel regardless of where they live or the route of administration that they're getting through that product. And I think another benefit and one thing a manufacturer should be looking at is how are you pulling your data to make sure if there starts to become challenges within that launch that you can then go in and pivot and be very fluid in the solutions and the interventions that you're providing to patients, because nothing is going to go seamlessly. And the earlier you can find out that there is a challenge, put an intervention in place, have a partner that works with you on that intervention, and then can come back and say it's working or not working, it really makes that launch a more seamless launch than what they're looking for in the market.
And this really kind of comes back to our sort of first question. It was, we founded the company with a couple of key principles that were part of it. One was improve patients' lives every day. It's one of our core values we talk about all the time. And it really is a company that's built around patient care and making sure we're focused on that first and foremost. And not everyone understands, but that's really what our manufacturer partners want too. They want the patient to be number one for the specialty pharmacy. They want us to not only be, talk the talk, but walk the walk. And it's how we built our foundation. But on top of that, the other thing we knew from the beginning is we had to be able to track the data. We had to be able to use data in the right way. And so we put extra things in place from the very beginning to allow us to get more data out of our clinical teams, to drive assessments that were meaningful and could provide meaningful data for our partners. And what we've been able to do over the years is continue to get better and better at providing data. And that's really where those two things really make a difference, I think, for our manufacturer partners. Make sure the focus is on patient care and provide meaningful data to them that they can use to help make sure that their patients are being taken care of the right way. And that's really the foundation of what Soleo was built around. We started SoleMetrics 12 years ago with that intention in mind, and that's why this move to SoleoRare is just the natural progression of how we've developed this patient care model that is not only about providing great patient care, but it's also about providing the data to articulate the value of what our clinicians do every day.
A key differentiator, I think, for Soleo is that we have a field team that has deep expertise and also relationships in the market. And if you think about a manufacturer when they launch, they don't come to market with all of the resources. Many of these manufacturers are startups, and they might only have one or two products that they're riding that wave. And if that wave is not successful for them, it could be very detrimental for the company. So picking a specialty pharmacy that has relationships already out in the field, already in those therapeutic areas, really allows the manufacturer to increase their share of voice, which also comes back to, as we've talked about before, the benefit to the patient is earlier diagnosis, earlier treatment. And so if you think about how we as Soleo can help manufacturers be successful, just having that network already in place really helps the manufacturer.
Yeah, that's great. I completely agree. We actually met with a manufacturer today that said that very thing, that our field team, they need our field team to help them with getting their product to market. And we've actually done it for them in the past, and they're looking forward to us helping them do it again. So.
Going back to the data, I think it's taken for granted, and I think it's confused because everyone can provide redistribution data, right? Where is the medicine being delivered? And I think that's what really differentiates us is the patient and therapeutic specific assessments that we create, right? We actually research what's most valuable to that manufacturer. What are the insights that we can provide that maybe a provider can if they're doing a provider buy and bill, but it's one where we're actually providing real experience, real world evidence data. And that's something that we've often had the value of providing data to our manufacturers for them to actually use our data in their publishing. And I think that's another thing. When we think about SoleMetrics, it is one where if we have therapeutic specific assessments, we're able to provide them the insights that they wouldn't necessarily capture. Those patients are going, from their provider office, and there's really no connectivity. The provider's probably not providing any level of data, and that's really where we play a significant role in providing those insights back to the manufacturer partner.
Yeah, I completely agree. And inside in the clinical team, it's extra work for them. It's not always easy to be able to document all the different things that we're asking them to document, but it's meaningful. It makes a difference. And from the beginning, we've always, we've been challenged by that, but we built our assessments in a way that we can be flexible, we can change, we can adapt to what the needs are of our partners and based on the patient's situation. And so it's something I think we intend to always do that, and we intend to continue to invest in not only the resources, but also the technology to make that more and more efficient for our clinicians to use and provide better and better data for our partners.
It's really a true partnership starting from the beginning of the patient journey all the way through. And I think all of these pieces really make Soleo Health a great partner for manufacturers when they're looking at launching into the market.
Drew, Jody, thank you. I appreciate your time. I look forward to hearing more about SoleoRare.
Thank you for having us.
Thank you, Craig.